Are you aware of the importance of urinary catheter care inspections? This video explores how eAuditor helps ensure safety, hygiene, and infection prevention. Discover the key elements of proper catheter management and compliance with safety protocols. Urinary catheter care involves managing a catheter to drain urine from the bladder. It encompasses hygiene, infection prevention, and monitoring for complications. Using eAuditor, inspections ensure hygiene and adherence to best practices. This helps healthcare providers minimize urinary tract infection risks. Proper care can significantly reduce infection rates and ensure patient safety. Log into your account. Infection prevention starts with hand hygiene and personal protective equipment. Healthcare staff must wash hands thoroughly before and after handling catheters. Proper use of gloves, gowns, and PPE is essential during procedures. Correct disposal of gloves and PPE prevents cross-contamination. Following these practices is crucial for infection control. Catheter insertion must occur under aseptic conditions with sterile equipment. Proper securement minimizes movement and prevents urethral trauma. Correct catheter positioning reduces tension and complications. Following guidelines for catheter size and type is crucial. These measures ensure safe and effective catheter management. Inspect drainage bags for proper positioning to prevent backflow. Ensure catheter tubing is free from kinks or obstructions. Verify the closed drainage system remains intact. Routine emptying of urine bags is essential. Proper perineal care and catheter site cleaning are crucial for hygiene. Continuous monitoring helps prevent catheter-associated infections. Look for signs like fever or cloudy urine indicative of infections. Daily assessments reduce prolonged catheter use risks. Regular evaluations determine if catheter removal is possible. Adhering to antibiotic stewardship programs prevents unnecessary antibiotic use. A comprehensive inspection using eAuditor ensures hygiene protocol adherence. Routine assessments and staff training are vital for infection prevention. You now understand how proper monitoring and policy adherence ensure patient safety in catheter care.